even in the mining. So any industry is at the risk, produce risk to the workers when they are working there. So what kind of thing in the industry is responsible? Yes, we all know that there are various particles which are there, fumes, chemicals, and even different types of organic elements. It can be just soil, pollens, fungal, so many things workers get exposed to, and they get various respiratory conditions. So what are the most common conditions? Of course, it can be from a simple allergic kind of symptoms like running nose, watering of eyes, throat irritations. That can be the initial symptoms of the patient, and then it can go to more severe form like asthma or chronic obstructive pulmonary diseases. And of course, workers, if continue to get exposed to these allergens, they are at the risk of developing lung fibrosis, that the contraction of the lungs, as well as they may not be spared of developing some underlying cancers in the lung. So that is how the severity comes into picture of these various exposures when these workers are working in these environments unprotected. So it is very important that we should provide services to all these workers, especially as I'm working in life care hospital, which is surrounded by lots of industries in Musafa area. So we are providing not only screening facilities for these workers, so plus also we are doing the periodic screening of these workers also to detect early the conditions if they are suffering from. So for example, any worker who start to work, it is very important to evaluate their lung functions, their underlying lung functions, as well as to diagnose if they are already suffering from any lung conditions. This can be like asthma, which he may not be aware, or which he might have suffered in the childhood and now he is stable. But it is very important, because once the worker goes and work in these environments, and if having tendency to develop asthma, he can develop life-threatening acute exacerbation. So this is very, very important. So what we are using here in our life care hospital, we are having facility to provide spirometry, to do the spirometry to assess their lung functions. We are doing the walk test with some special equipment, so that we understand that if there is any limitation in his activity of this particular worker. And then of course, if required, we have the facility to do X-ray. If required, we can do CT scan, and sometimes to diagnose very rare or not very common conditions, we go up to the situation where patient may require lung biopsy with the help of bronchoscopy. So this is the pulmonary services we are providing to these workers to help them.
Thank you, Dr. Rakesh, for this wonderful explanation of the how the lung can be damaged in these particular industrial workers. May I now ask Dr. Abhish regarding to give us some idea about what happens when when the workers are exposed, and how their kidneys can be preserved or can continue to start working. Dr. Abhish.
At the outset, I would like to thank the organizers and Dr. Shekhar for giving me this opportunity. I am a consultant nephrologist working in Life Care Hospital, Musafa. Basically, kidneys does the function of excretion, as you all know. Almost 180 liters of blood is filtered per day through the kidneys. It extracts all the waste from the blood and it is excreted out in the urine. During this process, kidneys and the nearby structures are mostly exposed to all these toxins in a very high concentration, in such a way that it can be easily affected. Not only kidneys but also bladder. When we are not passing urine adequately and frequently, the chemicals are in constant touch with the bladder epithelium, bladder cells, resulting in various sorts of injuries leading on to even cancer. So how these workers are exposed to these toxins there are only main 3 routes of exposures. One is through inhalation, as Dr. Rakesh told, and second is through ingestion, accidentally ingesting the toxins, and laborers can eat at the environment where there are a lot of toxic fumes, so that these food particles contains these toxins. And third is through absorption, through the skin. Some easily hydrocarbons which are easily crossing through the skin can easily enter into the body through the skin also. So what are the common chemicals that can affect the kidneys, or particularly in occupational environment, or lead, mercury, arsenic, cadmium, and various other agro pharmacies such as fertilizers, pesticides, and various other hydrocarbons, halogenated hydrocarbons, fuels, petroleum products, and defreezing agents. Everything can affect easily the. These are all exogenous chemicals that affects the kidneys. But in particular, endogenous substance can also affect the kidneys in the sense if a patient, if a worker had a severe crush injury, myoglobins are released from the muscles which can easily affect the kidneys, which is an endogenous chemical which affects the kidneys. And coming on to what are the what are the modes in which patients or workers are exposed to, are either acute insult which happens in industrial hazards, or a slow, long-standing, low-dose exposure which is a chronic form which is usually unnoticed. These chronic exposures may not have symptoms or signs. They have only non-specific symptoms and signs. So it is very difficult and it requires a high index of suspicion to catch up these patients at the earlier stages. So what are the non-specific symptoms? Maybe patients may have easy fatigue, lethargic, headache, loss of appetite, loss of sleep, myalgia, and leg swelling, frothy urine. These are the common symptoms of kidney diseases which go unnoticed for a long duration of time. Even just elevation of blood pressure can be a symptom of kidneys being affected. And who are more prone for these insult is patients under having already diabetic or hypertensive and underlying kidney disease, obesity, unhealthy lifestyles. These patients are more notorious for being affected by toxins by the kidneys. And dehydration, we have to mention a special note for dehydration because these patients may be exposed to heat naturally and unnaturally, resulting in reduced blood supply to the kidneys and less urine formation. Most of these chemicals are excreted in the urine. So less urine, more toxin retained in the body, and more urine, less toxin, and it is flushed outside the urine. So hydration has to be very much important for these patients. And thank you, sir.
Thank you, Dr. Abish, for the explanation that you have given regarding how the kidneys can be protected and what exactly are the risks that patients have. We have with us Dr. Uman. Unfortunately, the slides that he wanted to show are a little, I must say, disturbing. So we have just given a small clip art of what he is doing. He is doing excellent job in the field of, he is a hand surgeon who is also an orthopedician who is trained in microsurgery. So, Dr. Oman, what are the kinds of physical injuries that we are likely to see in your practice?
Hello, thank you, sir. So hand injuries are the most common injuries sustained in industries. So we at LLH Musafa actually deal with a lot of hand injuries. So the different types of injuries are, you could have crush injuries to the digits, where we try to actually salvage the digit by using flaps from different parts of the body, so that we don't end up with amputating the digit. Other injuries are like grease gun injuries, when high pressure grease is injected into the hand, and this is actually an emergency because sometimes when this happens, usually if it's not debrided early, the patient ends up losing his hand or finger. So early debridement is very important when you have a grease gun injury. Then we deal with all sorts of nerve injuries, digital nerve injuries, median nerve injuries, ulnar nerve injuries, and these require microscopic repair of the nerves, and if there is a loss of nerve tissue, sometimes nerve grafts from the lower limb. Then we also deal with composite tissue losses, that is when you have loss of skin, tendon, bones in the hand or the fingers, so where we need to get bones from other parts of the body. We need to get skin flaps or tendons transferred from different parts of the body to reconstruct the hand. We also do all sorts of tendon injuries, flexor injuries, extensor tendon injuries, radial artery injuries, ulnar artery injuries, digital artery injuries. And also we deal with total amputation of digits, where patients come with digits in the plastic cover and then we need to put it back. So this is called replantation surgery, and replantation of a digit at least takes about it takes 4 to 5 hours per digit, and it involves identifying the arteries to the digits, the small 1 millimeter veins to the digits, the tendons, the bones, and fixing all these things so that we get a good result. So in brief, I mean, these are all the injuries which we are dealing with, and we've been doing this for almost the last 10 years at LLH Musaffar. Additionally, I would like to also tell you about, I mean, what should be done if you have an amputated digit in an industry. So the first thing is, the digit has to be washed with water, rolled off in a moist piece of cloth or gauze piece, and then that should then be put in a plastic cover, and then that should be put in an ice container before it is transported to the hospital. So the digit should not be in contact with ice directly, because ice crystallizes in the microcirculation, and this can cause damage and ischemia to the digit. The thing is, once the amputated part comes to the hospital, I mean, the replantation should be done as quickly as possible. So although there are reports of replantation of the fingers done even 24 hours after injury, but then the ideal thing is to do it as early as possible. Thank you.
Thank you, Dr. Oman. May I ask Dr. Rakesh now to say what are the what are the precautions that can be taken to prevent the injury of lungs?
Hello. Actually, regarding the prevention of the conditions which I just mentioned in my previous answers, it is very important to follow a multifocal approach. So it is not like that one strategy can prevent all these incidents or the development of respiratory conditions in the workers. So first of all, it is industries have to make sure that when they are recruiting for any particular job of any worker they are recruiting, so they make sure that this worker is fit to work in that particular environment. So they have to select their workers according to their exposure and type of work the worker is going to do. So for that, the initial screening is very, very important, and we are providing these services to the industries. Workers are coming before joining, and we are screening them properly, and then we are giving our feedback that if this worker is fit to work in that particular environment or not. Secondly, it is the responsibility of the worker to follow a strict protocol during the work. They should follow the recommendations provided by the safety engineers or safety department. That is the responsibility of the worker, and of course it is the responsibility of their engineers or the safety head to make sure that the workers are following these instructions properly. And of course, workers need a regular training that how to prevent them. So this is very, very crucial. So the safety department should arrange workshops and all these before the worker starts working, as well as during their work also they should see that how the workers are trained. They should know that how to escape during emergency situations. So these are very, very important aspect of preventing these exposures. And then it is very, very important again, and the responsibility of the industries and their security and their safety department to provide the protective gears to these workers. So it is not like that one simple mask can prevent exposure for anything. So there may be different type of exposures, dust particles, different type of dust particles or different type of chemicals. So they require a different protective gears. So this is very, very important that they should decide that which type of protective gear the worker is required to prevent the development of any respiratory emergencies or to progression of any underlying respiratory disease. So this is one thing. And secondly, it is again important for any industry to establish one first aid room or first aid place where it should be equipped to handle all respiratory emergencies in form of providing oxygen, or if patient require any nebulization with the bronchodilators, some medications, some steroids. So these are some emergency stuffs which can be given in cases of emergencies. And then of course they should be in a position to transport these cases, those who are having severe acute exacerbations, to a nearby hospital which can provide all the facilities starting from emergencies, or sometimes these patients require ICU, intensive care unit, ventilator. So they have to decide that select the facilities where they should transfer these patients. So it is, again, I will say that is a multifocal approach, and starting from the screening, prevention, and of course taking care of the person or worker if he develops some illness.
Thank you, Dr. Rakesh. That was a very lucid way you have explained what exactly can be done to prevent the such problems. I'm going to risk the same question with Dr. Abish also. Will you, Dr. Abish, please tell us what exactly can be done to prevent, uh, in case of accidental exposure, how the kidneys can be protected?
Yes, sir. As I previously told, uh, hydration has to be very much emphasized in patient workers working under heat environment. Therefore, water access, sufficient, adequate water access has to be made by the employer, and toilet access has to be made also by the employer, because, as I told, more hydration, more water, more urine, lot of toxins are flushed through the urines. So, hydration and toilet facilities has to be made mandatory at the working space. And clothing, some uniforms may not have access to go for frequent toileting. That has to be addressed for. And clothing should be impermeable for toxins which can easily permeable to the through the skin. And reducing the exposure of fumes and toxins in the working environment has to be managed by sufficient equipments and engineering, by providing adequate exhausts and ventilation supports. And regular monitoring of these toxins in the air has to be made and documented, and if it is in excess, the guidelines has to be followed. And similarly, the toxin levels has to be checked in the workers' blood and as well as in the urine. And if it is beyond the permissive limit, they have to be given compulsory of leave and has to be rechecked. Only they can resume the work when the levels are in the permissive limits. And coming to the workers, they have to educate themselves. Earlier signs and symptoms has to be taught to them, and yearly the diagnosis, yearly the ECB will be the recovery and treatment. So they have to be educated well, and they have to have a knowledge and insight about the toxins they are handling via frequent referrals to the safe data sheets. And if at all a worker has been exposed to a toxin abruptly, like happening in industrial hazards, he has to be stabilized. Acute exposure, the patient will be critical and he has to be stabilized initially and given, if possible, give an antidote and ship the patient to tertiary care where all the facilities are available, including dialysis support. And this dialysis support for a poison is dictated by expert. This is the guidelines which dictate us how to manage a poison for requiring dialysis support. Here we have, under our organization, we have all sorts of dialysis supports ranging from hemodialysis, hemofiltration, continuous renal replacement therapy, till ECMO, a high-end life-saving support which is easily available in our organization. Thank you, sir.
Thank you, Dr. Abish, for that explanation, not just about what exactly needs to be done in such scenario, but the fact that these things are available at Life Care Hospital, Musafa. I will now ask Dr. Uman to say what exactly we can do. You very correctly explained what needs to be done in case of injury. What can we do now to prevent these injuries? That will be of interest to all of us.
So we'll discuss hand injury prevention in 3 sections. One is engineering controls, second is administrative controls, and then is use of personal protective equipment, that is PPE. So in the engineering controls, first thing is, you need to have machine guards, especially at pinch points where the rotating hinges, so that, these the injuries can be avoided. Then there could be, proximity limiting devices which prevent the hand from getting too close to injury points. Then you can have a stop guard. So when suppose somebody has just got injured, immediately you can press in the button and the machine stops totally. And lastly, you need machines which are ergonomically designed so that, the wrist and the hand and the fingers are put under less stress. The second thing is administrative controls. In this, the most important thing is patient education. The worker education. So the worker needs to be trained and retrained on how to use machines. And also, the organization should put up warning signals when a machine is not working or it is faulty, and then there should be, regular maintenance of machines. These are the three things under the administrative control. And lastly, and the most important, the personal protective equipment. So you need most important thing is the gloves. So you need the right gloves for the right job. So if a worker is working in a heat sensitive area, he needs a heat sensitive gloves. If he's working with sharp objects, he needs a tougher or a metal enhanced gloves. If he's working with electricity, he requires a non-conduction gloves so that uh, low voltage electricity does not hurt him too much. The second thing is he should avoid using jewelry or loose sleeves at work, because these can get entangled in machines and can cause very, very grievous injuries. So these are the three important things in preventing hand injuries.
Thank you, Dr. Oman. I think that was a very lucid explanation of what exactly needs to be done. The companies should be careful and the workers should be careful, and the regulations are always there. One of the most important things they say, as Dr. Oman was saying, is one of the most important thing is the human error that can happen. The human error that can happen in these scenarios primarily because of the stress they are facing. What has to be understood is that the stress has got a very important definition. It is basically the replenishment of the spent fortitude is not being done. Every work that we are doing, we are drawing on our fortitude, resilience, etc. How do you replenish it? We have to replenish it using leisure activity. This has to be told, the facility should be given to the workers to have some break in between, and the break time should be actually used for something that they are interested in. So many of these agencies have a play area, etc., where the worker can go after 2 or 3 hours or 4 hours of work and come back 10 to 15 minutes refreshed. The management of stress is also important because all three of my co-panelists will agree that presence of lifestyle disorders like diabetes, hypertension, heart disease, cardiovascular illnesses, etc., can definitely worsen the problem that they are facing. Accidents are bound to happen. What we can do is be careful. I think the take-home messages, anything anybody would like to give before we can open the question, we can start taking questions from the audience. Anybody wants to say anything that will be, say, in a nutshell, in a few minutes?
Sir, the most important take-home message is that it is a collaboration approach as far as the industrial health is concerned. So it is very important that the industry itself, the worker, the authorities, as well as in coordination with the healthcare facilities. So if we join our hand together, and it is very easy to safeguard their interest, and we can save these workers from going into severe conditions, either renal or injuries or respiratory. So this is very, very important. And I'm proud to mention that we as a life care or lifeline, we are placed in such an area where it is surrounded by thousands of industries. And we are really happy to serve these workers right from the screening, periodic workup for these, as well as in case unfortunate condition, if they develop some critical conditions, we are able to handle any complex situations, right from the OPD treatment, emergency treatment, also to the intensive care, as Dr. Abis mentioned, till the ECMO, where the artificial support can be provided till the worker is recovering. So that is the good part from the life care and lifeline point of view, and that's all. Anything?
So I have one point to emphasize here, because kidneys are silent disease. Kidney disease is a silent killer. So the in-house medico or medical person, the point of contact, the medical person should know, should have some insight about the kidney disease and the toxins related to the signs and symptoms related to the toxins, and he has to refer the patient to the tertiary unit as early as possible to prevent permanent damage of kidneys.
Thank you. Thank you all my co-panelists and all the audience. We can take questions if there are any.
If you've got a question, I'll bring the microphone to you. Let me know. Anyone raising their hands? Well, we're raising goodbyes so far, but All right, thank you. Thank you very much for the panelists. We're looking forward to our next
Thank you.
session. We'll clear the stage and we'll prepare.